Hello everyone, my name is Nikki Tedder and our Module 1 Discussion Forum 1.1. Uh, we are to answer our name and where you are working or doing field placement. Again, my name is Nikki Tedder and I am currently working for DBHDS in Virginia, the Department of Behavioral Health and Developmental Services. Prior to that, I was working crisis at Highlands Community Services as the co-response peer. I rolled out with police department, things like that, on mental health and SUD cases, sex trafficking, domestic violence, whatever the call was. Um, Experiences that I have had with psychopathology, mental health in the past. I have had classes. I've had psychology classes. Sociology classes. I have also worked a lot of crisis at work, when I was at Highlands. I also would go out to wherever the consumer was at the time. I would have to assess where they were capacity wise. I would also have to assess, you know, um, what level of psychosis they were having, things like that, to determine whether or not they needed further assessment, whether they need to be pre-screened, whether they needed to be placed or whatever. And if it was something that could be mitigated in the field, then I done that. It just depended, on what the situation was and what the consumer was experiencing at the time. So what do I hope to gain from this class, and how do I hope to apply knowledge from this class into my social work role or practice? So I'm hoping to gain a better and deeper understanding of diagnosing all the things that have to do with the psychopathology class that we have here, and the things that I have looked over so far. Um, and the way that I would use that in the social work role or practice would be, I would like to stay with crisis, or at least some form of crisis. And with that, you're looking at TDOs, ECOs, things of that nature. So, to be able to make a better determination for the client, consumer, whatever it is that you call them in your area. Um, to be able to better assess what the least restrictive means would be at that point in time. So, what, if any, questions do I have as we begin the class? I would be willing to bet that there are probably so many questions that I have at this point that I'm just not aware of them yet. I'm sure that they will come as we proceed further within the term, and as those come about, I will reach out and I will ask those questions. But that is my Module 1 Discussion Forum 1.1. Thank you.